last year, Dara Torres became the first woman in her 40s to swim in the Olympics. She won 3 medals, but now she's suffering from a potentially career-ending injury. And our Dr. Jennifer Ashton is here with an early show exclusive. Good morning. Good morning, Harry. Dara Torres' problem is actually her knees, and this is an issue affecting millions of Americans. So she's decided to undergo a procedure that uses biotechnology to regrow her own cartilage cells.
I would like to be able to go for 2012, and I'd like to be able to chase my daughter around without any pain in my knees and bend down and pick her up and not have any pain.
The world was reintroduced to swimmer Dara Torres last year, when at age 41, she trained for a record 5th Olympics, not long after the birth of her daughter, Tessa. Her incredible comeback and stunning physique inspired boomers and young people alike. And last August, Dara brought home 3 silver medals from Beijing. But just a year later, her future looked bleak.
Some days it hurts to walk. Going up and down stairs, forget it. That's always painful.
Dara is suffering from severe knee pain caused by having little cartilage in her left knee.
Right now, the status of her knee is that it's a career-ending problem.
It'll take a couple hours. Just make sure I do it perfect.
Dr. Tom Minus of Brigham and Women's Hospital in Boston is one of the top surgeons in the country performing a radical procedure known as ACI, autologous chondrocyte implantation. First, he removes 10,000 cartilage cells from Dara's knee, about the size of 3 Tic Tacs. They're sent to a lab and grown for several weeks into 50 million cells.
Okay.
During surgery, Dara's knee is opened up. Dr. Minus sews a synthetic patch over the pothole where her cartilage is missing.
Thank you.
Then the 50 million cells are injected. If successful, they will harden and grow into healthy cartilage. 6 weeks after surgery, Dara is back in the pool.
How is your knee doing?
My knee's doing great. I went in for my 6-week checkup, and they did an MRI scan on it and showed that the cartilage is growing.
Dara still can't kick when she swims, and she won't be weight training again until the middle of next year. With 12 Olympic medals already in her collection,
Gold, the bronze, the silver.
Dara says it's the rewards at home that are the most important.
The competition in swimming, that's so not even an issue compared to trying to be there for your daughter.
But with her newly repaired knee, this fierce competitor isn't ruling out a run at the Olympic Games in London.
I don't know what my body can do. I don't know if it'll hold on for 2 years training for 2012, but why not give it a try?
Now, ACI costs about $60,000, most of which is covered by insurance, and there is a more advanced procedure undergoing trials right now that's less invasive, with recovery time much shorter for patients who will be having it.
That is remarkable. Now, is this really only for world-class athletes, or is it for folks who are 58 and sometimes have trouble on the golf course?
It actually could be for the weekend warrior. When we spoke to Tom Minus up at Brigham and Women's, he said, yes, of course, Dara is the exception, and she is amazing in terms of her ability, but he's actually seeing a lot of people who are in their 30s and 40s just worn down the cartilage in their joints, and this, we should mention, is potentially really exciting as a last effort before someone goes on to a total knee replacement. It is amazing.
But 60 G's, that's not cheap.
Most of which covered by insurance. Again, the cost of a knee replacement is up there too, so,
All right.
But she's amazing. Yeah.